And that's why I was so proud of the fact that we were able to unite across the aisle in this parliament to form the Parliamentary Friends of Suicide Prevention, with working together with my colleague, the member for Barara. And, you know, I think when we first started that process, we wondered how much we could achieve. But it really has been rewarding to see what we've been able to do, the unity we've been able to forge across the aisle, having both Greg Hunt, Minister for Health, and our Shadow Minister, Julie Collins, attend a lot of our activities and reach consensus on some policy initiatives. And through that mechanism, we were able to bring up, for example, Dr Duncan McKinnon and his team from Bega, who had really explored a fantastic initiative through our teen clinic concept that working through Greater Pacific Health down there, which addressed the real issues of why kids weren't reaching out for help and what sort of support we could provide them to eliminate this curse. And it really works, you know, providing that initial portal for kids to go and see nurses in a non-threatening situation, timed with their transport to and from schools, and then, you know, being able to take that further if necessary, finding means to do that without, of course, any cost or charge to the kids. And then working that through, of course, with counsellors in the schools, etc., become a really successful model. And I was really pleased that they were able to tell that story up here through that committee mechanism, and then salute the Minister taking on the lessons from that and then expanding and funding the teen clinic project through areas of the Bermagui Medical Centre, Corallo Medical Centre in Eden, Lighthouse Surgery in Narooma, and the Main Street Medical in Merimbula, and the Kiama Medical Practice too, further up the coast, has also benefited from this. So I'd like to see this taken nationwide, of course, using our GP networks, because that's so ubiquitous. It's been great to see what Headspace facilities have done, a bit patchy, of course, depending on the location and how those are being operated. And you can't have Headspaces everywhere in the country. So I think being able to build on this network of using our GPs and nurses to create a nationwide approach to this is a great way forward. So I'm really pleased with the work that the committee's been able to do to get that policy process underway. I'm also, though, concerned about the issues to do with our veterans in rural and regional areas and the people who are depending on Centrelink services. I know there's been a drive in recent times everywhere to try and create efficiencies and automate stuff, but if you take the human out of human services, there's a problem. And that's particularly amplified in rural and regional areas. If my veterans don't get a chance to speak with a person, or if my senior citizens are forced to try and deal with online services, the struggles they have dealing with computerised services where they don't fit within dialogue boxes has caused an enormous amount of stress out there. And our electorate officers basically become an adjunct to Centrelink. And we have really, my crew have had a lot of pressure put on them dealing with people in high states of stress and anxiety, but the work they have done has prevented a lot of potential suicides in helping people through that. So I'd like for us to step back and have a look at providing better services in human services using humans.